Hi there, this is Nursing Education Videos. Today I will be reading Hypochloremia versus Hyperchloremia Nursing NCLEX Review on registerednursern.com. All credit for this information that I am reading goes to Sarah at registerednursern.com. All credit for the information that I am reading, again, is that goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. The links for the website will be included in the description box. So hypochloremia versus hyperchloremia Nursing NCLEX Review. This review is part of a comprehensive fluid and electrolyte series. In this review, you will learn the causes, signs, and symptoms and nursing interventions associated with hypo and hyperchloremia. And don't forget to access the free hypochloremia and hyperchloremia quiz when you're done reviewing this material. Chloride. What is chloride? Chloride is an electrolyte that has an important relationship with other electrolytes, especially sodium. Chloride is negatively charged ion, while sodium is positively charged, and they both like to congregate outside the cell. Therefore, because of this, usually if there is loss of sodium, there will be a loss of chloride, vice versa. In turn, there is some overlapping with the causes, signs and symptoms, and interventions. Chloride also has an opposite relationship with bicarbonate. When chloride is low, bicarbonate is high. In part, because how there is an exchange in the red blood cell for proper gas exchange. Furthermore, when an imbalance of chloride occurs due to either metabolic acidosis or alkalosis, the potassium level will be altered as well. So that is why, as the nurse, when you're seeing a chloride imbalance, you may also want to look at the sodium, bicarb, and potassium levels. Chloride plays a role with acid-base balance in the body, along with balancing the fluids in our body by working with sodium to maintain osmotic pressure. Chloride is also needed to make hydrochloric acid, which plays a huge role in food digestion. The kidneys help maintain chloride blood levels by taking what you don't need and excreting it in the urine. Chloride is also excreted through sweating and gut juices. Therefore, if chloride is imbalanced, especially high, it may be a kidney problem because specific parts of the nephron removes chloride from the blood and places it in the urine. If the kidneys aren't functioning right, this can't happen, so more stays in the blood. Normal levels of chloride is 95 to 105 milliequivalents per liter, so 95 to 105. Hypochloremia. Low chloride levels in the blood, so less than 95 milliequivalent per liter, is caused by loss of chloride, the GI system, vomiting, gastric juice loss via NG tube suction or ileostomy. Diuretics such as thiazides and loop diuretics affect how renal tubules reabsorb sodium and chloride, which causes more loss of the ions in the urine. Burns. Cystic fibrosis has high amounts of chloride in their sweat. Metabolic alkalosis, increase in bicarbonate, leads to low levels of chloride. they have an opposite relationship due to how each ion shifts in the red blood cells for proper gas exchange. Fluid overload. Diluting extracellular fluid due to CHF, so congestive heart failure, SIADH, so syndrome of inappropriate antidiuretic hormone secretion. Too much ADH is released, causing the body to retain water, which dilutes the sodium level, is SIADH. Signs and symptoms of hypochloremia tend to be associated with whatever is causing the low level, rather than the level being low itself. So you want to look at what is causing the low level to identify the signs and symptoms, and tends to look like hyponatremia signs and symptoms, but you may see dehydration, increased heart rate, decreased blood pressure and fever, vomiting, diarrhea, and feeling lethargic. The nurse's role in treatment for hypochloremia. Mnemonic loss, LOSS. L for look at the patient's sodium level and assess for signs and symptoms of hyponatremia. Normal sodium levels is 135 to 145 milliequivalent per liter. Remember, salt loss for signs associated with hyponatremia. So normal levels of chloride is 95 to 105. So 95 to 105 milliequivalent per liter. So the mnemonic salt loss for signs associated with hyponatremia, which is low sodium, are seizures and stupor, which is a decrease in consciousness, confusion. A for abdominal cramping. L for lethargic. T for tendon reflexes diminished and trouble concentrating. L for loss of urine and appetite. O for orthostatic hypotension and overactive bowel sounds. S for shallow respirations, which happens late due to skeletal muscle weakness. S for spasms of muscles. In addition, monitor neurostatus. Patients can become very confused and are at risk for injury. This confusion can be from swelling in the brain. Seizure precautions, respiratory precautions, or seizure precautions and respiratory status, ins and outs, vital signs, especially blood pressure and weights. O for other labs to monitor. High bicarbonate and low potassium are the labs to monitor, especially if this is due to metabolic alkalosis. Bicarbonate and potassium are also related to the balance of chloride because they all work together to balance the acid-base system and our fluid balance in the body. Saline. Normal saline 0.9% IV administration to replace chloride. And S for sources of chloride-rich foods. Table salt, tomatoes, olives, seafood, processed meats, and canned foods. Next is hyperchloremia, which is a high chloride in the blood, greater than 105 milliequivalent per liter. Causes is due to high intake of sodium, such as IV fluids, hypertonic fluids, or too much saline. Not drinking enough water or losing too much water through vomiting, diabetes insipidus, urinating so much fluid, and sweating. Losing too much bicarb versus via diarrhea. Metabolic acidosis, kidney failure, or medications that cause it. Hyperaldosteronism, so Conn's syndrome. Too much production of aldosterone retains sodium along with fluid and excrete potassium. Corticosteroids. So signs and symptoms of hyperchloremia tend to be associated with whatever is causing the high level, rather than the level being high itself. So you want to look at what is causing the high level to identify the signs and symptoms. And it may look like hypernatremia and acidosis signs and symptoms. Signs and symptoms of hypernatremia that could be present with hyperchloremia. Remember mnemonic fried. F for fatigue. R for restless. Really agitated, confused, central nervous system changes. I for increased reflexes, respirations that progress to seizures and coma. E for extreme thirst, which is a big sign. D is decreased urine output, dry mouth/skin. So from what I understand here is that hypochloremia and hyponatremia go together. So if there's low chloride, there's probably going to be low sodium. And then hyperchloremia and hypernatremia, so a high chloride and high sodium, goes together. So nurses' role in treatment for hyperchloremia. Mnemonic HICL dash. H for hold sodium chloride infusions. Further increase levels of chloride, along with sodium and chloride-rich foods. So they need low sodium diet. I. Instead, lactated ringers may be used to help decrease chloride. Y. The lactate is turned into bicarb, which helps. So bicarb is bicarbonate, so which helps increase bicarbonate levels and lower chloride. Remember, bicarbonate and chloride have an opposite relationship, where if there's high bicarbonate, there will be low chloride, and if there's low chloride, there will be high bicarbonate. If the cause of hyperchloremia is a metabolic acidosis, the increase in bicarbonate will help increase the pH in the blood. In addition, the administration of bicarbonate and certain diuretics can help decrease the chloride level too. C for collecting ins and outs, weights, vital signs. L for labs to monitor, such as chloride, sodium, bicarbonate, to make sure not becoming too alkaline and blood pH increasing too much. Potassium, where hyperkalemia, if acidosis presents, potassium leaves the cell and moves into the extracellular, hence blood, in exchange for hydrogen ions. The references for this information is Chloride in Diet, Medline Plus Medical Encyclopedia, medlineplus.gov.2021, retrieved 29th November 2021 from https medlineplus.gov/ency/article/0024117.htm. Shremankar, Batari S.electrolytes, updated 2021 July 26 in Stat Pearls Internet. Treasure Island FL Stat Pearls Publishing, 2021 Jan. Available from www.ncbi.nlm.nih.gov/books/nbk541123. And please share this information as per their website. Thank you for listening. I hope this information was helpful and engaging. Please feel free to subscribe and click the like button, and go to registerednursern.com for more information, and check out their YouTube channel as well. I hope everyone has a good day. Thanks again.